In the ever-evolving world of medical research, serendipitous discoveries often lead to groundbreaking treatments for unexpected conditions. One such potential breakthrough is emerging with semaglutide, a medication originally developed for diabetes management that may hold promise in treating addiction. Semaglutide, marketed under the brand names Ozempic and Wegovy, belongs to a class of drugs known as GLP-1 receptor agonists. Initially approved by the FDA in 2017 for treating type 2 diabetes, Ozempic, and later in 2021 for chronic weight management, Wegovy, semaglutide has gained significant attention in recent years. However, its journey from diabetes treatment to potential addiction therapy echoes a familiar pattern in pharmaceutical history. This pattern of drug repurposing is not unprecedented. Perhaps the most famous example is sildenafil, better known by its brand name Viagra. Originally developed in the early 1990s to treat chest pain, sildenafil's unexpected side effect led to its eventual approval in 1998 as a treatment for erectile dysfunction. This transformation from a cardiovascular medication to a revolutionary treatment for sexual health underscores the importance of observing and investigating unexpected drug effects. Semaglutide's primary function is to mimic glucagon-like peptide-1 GLP-1, a hormone naturally produced in the gut after eating. GLP-1 plays a crucial role in regulating blood sugar levels by stimulating insulin production and slowing gastric emptying, which contributes to feelings of fullness. By binding to GLP-1 receptors in the pancreas, semaglutide helps stabilize blood sugar levels in diabetic patients. Additionally, its effect on gastric emptying and appetite suppression has made it an effective tool for weight management. However, the story of semaglutide took an intriguing turn when patients began reporting an unexpected side effect: a reduced interest in alcohol consumption. Even individuals who previously struggled with alcohol addiction found their cravings significantly diminished after starting semaglutide treatment. This observation prompted researchers to investigate the potential link between GLP-1 receptor agonists and addictive behaviors. The scientific basis for this potential new application lies in the distribution of GLP-1 receptors throughout the body, including areas of the brain associated with reward and addiction. This widespread presence suggests that GLP-1 receptor agonists like semaglutide might influence not only metabolic processes, but also neurological pathways involved in addictive behaviors. Animal studies have provided compelling evidence for the anti-addictive properties of GLP-1 receptor agonists. In mice, rats, and non-human primates, these drugs have been shown to reduce alcohol consumption and decrease the rewarding effects of alcohol. Furthermore, studies have demonstrated similar effects on cocaine consumption, nicotine reward, and related behaviors in rodents. These findings suggest that GLP-1 receptor agonists may blunt the dopamine release associated with substance use, potentially altering the reward mechanisms that drive addiction. The mechanism by which GLP-1 receptor agonists affect addiction is fundamentally different from existing addiction treatments. Current medications often work by making individuals feel ill when they consume drugs or alcohol, essentially creating a negative association. In contrast, GLP-1 receptor agonists appear to directly modulate the reward pathways in the brain, potentially reducing the pleasurable effects of addictive substances without causing adverse reactions. Despite the promising results in animal studies, human research on GLP-1 receptor agonists and addiction is still in its early stages. As of June 2023, only a handful of studies have specifically examined semaglutide's effects on addiction, primarily in rodents. These studies have shown encouraging results, demonstrating decreased alcohol intake and reduced activity in brain reward mechanisms. One human study found that a GLP-1 receptor agonist reduced alcohol use in obese patients, but not in non-obese individuals. This finding highlights the complexity of addiction and the potential interactions between metabolic factors and addictive behaviors. It also underscores the need for more comprehensive human trials to fully understand the efficacy and limitations of these drugs in treating addiction. The anecdotal reports of reduced alcohol cravings among semaglutide users have generated significant interest in the medical community. However, it's important to approach these reports with caution. The current surge in attention may be partly due to the recent popularity of semaglutide for weight management, leading to a larger pool of users and potentially skewing perceptions of the drug's effects on addiction. several crucial questions remain unanswered regarding the potential use of semaglutide and other GLP-1 receptor agonists for addiction treatment. One key concern is the long-term efficacy of these drugs. Many animal studies have focused on short-term effects following GLP-1 receptor agonist injections, but substance use disorders are chronic, long-term conditions. It's essential to determine whether these medications can provide sustained benefits over extended periods. The development of new addiction treatments is of paramount importance in the medical field. Currently, there are limited medication options for treating substance use disorders, and those that exist don't work for everyone. Moreover, there are no approved medications for cocaine or methamphetamine addiction, underscoring the urgent need for novel therapeutic approaches. If semaglutide proves effective in treating addiction, it could offer several advantages. As an already FDA-approved drug, semaglutide could potentially be fast-tracked for approval in treating addiction. This accelerated process is possible because the drug's mechanism of action, safety profile, and side effects are already well documented, potentially saving years of research and development time compared to entirely new drugs. Clinical trials investigating semaglutide's effects on substance use are currently underway. These studies will provide crucial data on the drug's efficacy in human subjects and help determine its potential as an addiction treatment. If successful, these trials could pave the way for a new approach to addiction therapy, offering hope to millions of individuals struggling with substance use disorders. The potential repurposing of semaglutide for addiction treatment highlights the importance of remaining open to unexpected drug effects and the value of comprehensive observation in clinical practice. Just as Viagra's journey from a chest pain medication to a treatment for erectile dysfunction revolutionized men's health, semaglutide could potentially transform the landscape of addiction treatment. However, it's crucial to temper enthusiasm with caution. While the preliminary findings and anecdotal reports are promising, more rigorous scientific investigation is needed to establish semaglutide's efficacy in treating addiction. Factors such as individual variability, long-term effects, and potential limitations must be thoroughly explored before any definitive conclusions can be drawn. The story of semaglutide serves as a reminder of the complex and often unpredictable nature of pharmacological research. It underscores the importance of remaining vigilant for unexpected drug effects and the potential for existing medications to find new applications in treating seemingly unrelated conditions. As research progresses, the medical community eagerly awaits the results of ongoing clinical trials. If successful, semaglutide could offer a new tool in the challenging fight against addiction, potentially saving lives and alleviating the immense personal and societal costs associated with substance use disorders. In conclusion, the potential repurposing of semaglutide from a diabetes and weight management drug to an addiction treatment exemplifies the dynamic nature of medical research. It highlights the importance of serendipity, careful observation, and rigorous scientific investigation in advancing our understanding of human health and disease. As we continue to explore the full potential of semaglutide and other GLP-1 receptor agonists, we may be on the cusp of a significant breakthrough in addiction treatment, offering new hope to those struggling with substance use disorders.